Hi, I'm Dr. Charlie Saboura with Wellstar Chiropractic at the East Cobb Health Park. I'm here with Connie. Connie's from Acworth, and Connie has been working in her yard. This is the time of year when everybody goes out there and overdoes it sometimes to make everything look pretty. I'm sure her yard looks fantastic. Working in the yard sometimes causes some low back pain, some fixations, and if they're exacerbated by any kind of condition underlying, whether it's a degenerative or arthritic, it becomes a big problem and it limits mobility. Connie was in a lot of pain because she overdid it this time. And so this is Connie's second visit for this condition. She has a little bit more mobility, but still in quite a bit of pain, and it's mostly on the right side of her low back. That's what we're going to address. Because this table moves up and down, it's very easy for Connie to get on the table. So Connie, you ready?
Ready.
All right, go ahead and put your hands on there, and here we go. So part of every visit is really checking in Epic, our computer program, on any kind of contraindications to adjustments. I'm very familiar with Connie's healthcare history because we have access to Epic on our computers here. First thing I check, make sure that the legs are evened out. If they're not even, that usually indicates muscle spasms. And then palpating to feel for any kind of inflammation or fixation. And even as I touch here, I feel the muscles pull underneath my hand where they're spasming, because this is where the tender spots are. And this is the sacroiliac joint, where the ilium, which is part of the hip, attaches to the sacrum, which is part of the spine. Very common area to have injury, to have sprain, and this is what we're dealing with here. It's a really severe sprain of that sacroiliac joint. The first thing I'm going to do is mobilize it from side to side to improve the mobility, increase the circulation, decrease the inflammation. So Connie can go back and be Superwoman again. So as I use this table to achieve lateral flexion, it almost pumps the fluid back and forth. Again, the reason mobility is important to the spine is it alleviates any kind of fixations, and it also improves circulation, which decreases inflammation. And this is the part where we achieve flexion distraction. It helps it out. You okay? Edit out. Okay, next I'm going to use this little massager. Again, this massager breaks adhesions loose. It moves, it vibrates at a speed where it's really beneficial to break any kind of fixation and adhesions around the muscles where the problem area is. So this is one of classical cases of acute low back pain. Acute means it came on suddenly and it's very painful and very uncomfortable. So to reduce the pain, reduce the uncomfortable feeling, we're gonna improve that mobility. Again, this is chiropractic manipulative therapy, and that's what I'm about to do here. Adjust Connie's sacroiliac joint on the right side. So Connie, I'm going to ask you to lay on your side, left side down. And as you can tell, Connie's movements are slow because of the pain. So all right, cross your arms, you know the routine. There it is, that right side. All right, so we're gonna get the other side moving as well. Still, yeah, here, I can help. Straighten out the bottom leg. All right. So I'm contacting that right sacroiliac joint. Perfect. Right at the right side too. All right. You ready? So here's what we're gonna do. Yep. Okay. Go ahead and stand up. And we're gonna do side to side. Lift up. So part of the adjustment is also advice about what type of therapy to do after an adjustment. Mobility is a key with any kind of fixation. You want to mobilize, you want to keep it moving, but you don't want to overdo it. That's what gets us in a lot of trouble, is when we overdo it. We feel overconfident, and sometimes we overdo it, which causes the acute pain to set in. So lifting up the legs one side at a time, 7 times on the right, 7 times on the left, throughout the day is going to improve that circulation and decrease some of that inflammation.